What's the difference of short stature in different disorders? A delayed bone age with short stature suggests hormonal or systemic disorders. A normal bone age with short stature may be due to genetic cartilage dysplasia or growth plate disorders. So, what are the causes of dwarfism? Hormonal, extrinsic, or genetic causes? Which hormones affects the growth? Deficiency of them causes dwarfism. Growth hormone, intrinsic factor, thyroid hormone, androgen, glucocorticoids, and insulin deficiency may cause dwarfism. So, growth hormone deficiency, how does it cause dwarfism? GH deficiency, GH receptor defect, or defective synthesis of IGF causes dwarfism. May be autosomal dominant, recessive, or X-linked. There is short stature, micropenis, and increased fat. Bone age is delayed. There are two more dwarfisms related to growth hormone abnormalities: Laron dwarf and sexual etelotic dwarf. So what happens in Laron dwarf? Dwarf children with circulating high levels of GH and low levels of IGF. In these patients, the GH end organ unresponsiveness is present so that its level is high but insulin-like growth factor is low. The second disorder is sexual etelotic dwarfs. These children have congenital isolated GH deficiency that causes dwarfism. But they are sexually mature, women conceive and even give birth and lactate. The cause of thyroid hormone deficiency dwarfism. Thyroid is essential for normal growth and skeletal maturation. In hypothyroid children, bone growth is slow and epiphyseal closure is delayed. Why cretins are dwarf? Thyroxine affects the ossification of cartilage, growth of the teeth, contour of the face, and proportions of the body. Cretins are therefore dwarf and have infantile features. Infants appear normal at birth, but they have difficulty in feeding with prolonged jaundice, hypotonia, large tongue, delayed bone maturation, and pot belly and umbilical hernia. So what's the effect of androgen on growth? Androgen ultimately stops growth by fusing epiphyseal cartilage to the long bones. This is why pituitary dwarf, when treated with testosterone, grow fast but then stop growing because testosterone or androgens cause epiphyseal closure. That is why the patient with precocious puberty are also dwarfs. So what's the effects of glucocorticoid, diabetes, and estrogen on growth? Glucocorticoid, diabetes, and estrogen decrease somatomedine activity. Adrenalectomized animals have retarded growth, whereas excess glucocorticoid is a strong inhibitor of growth. Therefore, children taking steroids have slow growth as long as they are on these medications. So what are the extrinsic causes affecting growth? Nutrition and food are most important causes affecting growth. Growth promoting factors require caloric energy, amino acid, vitamin, trace metals. Malnutrition impairs chondrocyte activity and it reduces insulin-like growth factor and its binding protein levels. Injury and diseases stunt growth because they increase protein catabolism. And there is a catch-up growth of about 400% that occur after an illness. Amongst the genetic causes, achondroplasia, a spontaneous genetic mutation in the egg or sperm. The incidence of new point mutation in spermatogonia increases with paternal age. Condition may be sporadic or familial. So what's the cause of achondroplasia? It's due to the mutation in fibroblast growth factor receptor 3. The primary defect is abnormal chondrocyte proliferation at the growth plate that causes development of short, thick, long bones. Clinical features are short limbs with normal trunk with large head, saddle nose, and an exaggerated lumbar lordosis. Severe spinal deformity may lead to cord compression. The second cause is gonadal dysgenesis dwarf or Turner syndrome, and these patients have XO chromosomal pattern. Prader-Willi syndrome, obesity with short stature, mental retardation, hypogonadotropic hypogonadism, hypotonia, small hands and feet, fish-shaped mouth, and hyperphagia. Most patients have chromosome 15 deletion.